Hello, my name is Mr. Haytham Fardoun. I'm a consultant gynecologist surgeon at Oaks Hospital, Colchester, which is part of the Ramsay Health Group. My specialties in gynecology would include menstrual disorders, endometriosis and pelvic pain, urogynecology, which would include prolapse and bladder dysfunction, and I do laparoscopic surgeries and open abdominal surgeries and vaginal surgeries for various gynecology conditions. There are various levels of diagnosis endometriosis. Endometriosis could have some effect on getting pregnant if it is affecting the pelvic anatomy in the form of some adhesions or difficulty conceiving because of pain also with intercourse, which causes difficulty with conceiving. Mild to moderate endometriosis is managed by laparoscopic surgery to relieve the symptoms, or by some medical treatments which are non-hormonal, including medications called tranexamic acid and mefenamic acid to reduce the bleeding and the pain. However, if we have a more severe form of endometriosis, laparoscopic surgery could help with that, but usually severe forms of endometriosis might require fertility treatments in the form of assisted reproductive technique. Adding to that, endometriosis on its own has no direct effect on pregnancy in the form of the outcome of the pregnancy. However, there might be a higher rate of miscarriages in early pregnancy compared to endometriosis. However, it has no effect on the pregnancy progress in itself and the delivery of the baby. When we talk about menstrual bleeding and periods, it's very important to individualize taking history from the patient, as what seems to be very heavy for one patient might be acceptable or okay for another. Having said that, heavy period would usually include flooding. You would need to change a tampon or a thick pad every half an hour to 1 hour. It is soaked. It is debilitating in the sense that the patient would have to stay at home for days for the duration of the heavy part of the period. This is usually treated pharmaceutically or surgically. As for the regulation of the period, you'd expect a few days of bleed in a cyclic way, and every lady would have a pattern. However, usually it's 28 days, and if it goes out of that a few days, give or take, like 2-3 days early, 2-3 days late, this still counts as a regular period. Anything outside that, which is big gaps, much shorter, much longer in a random way, or bleeding between the periods or after intercourse, this counts as a irregular period which warrants investigation. If you're concerned about any gynecology condition, including and not exclusive of pelvic pain, period problems, endometriosis, recurrent miscarriage, or any bladder problems or prolapse, you could please give the Oaks Hospital in Colchester a call, and we'll be more than happy to see you in our clinics.